The new guidelines for infant sleep are in regards to sudden infant death syndrome, or SID. So is the Back to Sleep campaign from the AAP, which recommended that all, especially newborns, are sleeping on their back rather than previously we had them on their bellies. This is going to be in a bassinet on their own with nothing else in it, in the room with mom and dad for at least the first 6 months. It should ideally be a cool environment, and one where things like pacifiers are actually protective again too. And so having a pacifier in the crib for the child as well. Anything for warmth, such as a swaddle, should be kind of tighter fitting and without any opportunity for it to potentially cover the child's face as well. It's very, very difficult in the beginning because we don't have much of a circadian rhythm or a sleep-wake cycle established yet in newborns. They pretty much wake up when they are hungry and go to sleep when they're full, and they can sleep 17 plus hours a day as a newborn, and that will gradually over infancy and childhood decrease. But in the beginning, it's difficult until 2 months for most kiddos. Most babies are up every 2 to 3 hours in the beginning. They'll stretch a little bit longer to 4 and 5 hours here and there. But that's not consistent amongst every baby. Every baby is a little bit different. Around 8 weeks, we start to establish a sleep-wake cycle. And at that point, we can really capitalize things on a solid bedtime routine, things like bath before bed, having all the lights on during the day, all the lights off in the nighttime can really help babies start to establish that rhythm. Whereas closer to 3 and 4 months, they start to hit their stride with sleep and will give you longer stretches so that you as a parent are rejuvenated and can keep going. Sleep training is a fairly hot topic. I mean, always for parents, but especially now with the internet, there you'll see a umpteen different types of sleep trainings and what you should absolutely do and what you should not do. And I try not to paint with so black and white, especially with kiddos and sleep in the beginning. So all kiddos, again, to sound like a broken record, will be different. And with that, we'll respond differently to different sleep training methods if that is the case. The data is a little bit mixed on timing for self-soothing, which for me is the good marker to know that the child is ready for some form of sleep training. But typically around 4 to 6 months is when I'll recommend, especially if the child is not sleeping as well as we know they could be, to start with some form of sleep training. I alluded to the total number of daily hours of sleep decreases as we go into toddlerhood. 4 to 12-month-olds should be sleeping realistically 12 up to 16 hours a day, and that decreases to 11 to 14 hours around a year. You'll also notice nap schedules change so that's a total daily number, not in one stretch. Nap schedules will often be 2 to 3 naps in infancy, and then around a year, again, all babies being different. Some are ready to drop out a nap or two at that point and will be consistent 1 nap per day people. I also, though, encourage listening to your child, right? If they are very much 2 nap a day kind of kiddos, forcing them onto a 1 nap schedule can be met with a lot of resistance. And so it's both a mixture of routine, but also listening to your child and their needs.